Hello.
How you doing today?
I am doing well. How are you?
I'm doing pretty good.
Pretty good. Okay. Well, considering the circumstances, welcome to the clinic. My name is Dr. Perez, and I will be the physical therapist seeing you today. So I have a doctorate in physical therapy, and I've been working with your team for quite some time. I believe this is the first time we've met, correct?
Yes, first time.
Okay, perfect. Well, like I said, welcome to the office. I have a couple things here that we should go over. Okay. So if it's all right with you, I will get started by obtaining some just kind of basic preliminary information. So I have here that your name is
Mason Johnson.
Perfect. And can you just confirm your date of birth for me?
February 1st, 1990.
Perfect. Great. So just to get a little bit of kind of preliminary assessment stuff out of the way. So I have that you've played semi-professional basketball for about 5 years now. With the same team?
Yes.
Okay. Is this your first sports-related injury?
Yes, first one.
Okay. So it looks like the physical therapist on site wasn't able to really isolate the injury. They had some trouble figuring out exactly what was going on.
Okay.
Okay, so that's why they sent you here. All right, Mr. Johnson, if I could just have you tell me a little bit more about what actually occurred. So as far as like the injury, what were you doing prior to, and then what actually happened?
Prior to, we were in game at the time. Going into the injury, I was going up for a rebound, kind of got undercut by a player, kind of just came down wrong, kind of hit my head a little bit,
okay.
As well as my shoulder.
Got it, okay. And that was the left shoulder?
Yes, left shoulder.
And you did hit your head?
Yes.
Okay. So as far as pain, are you currently having any active pain?
Just pains mainly around my chest area,
okay.
A little bit of my shoulder, and then also my back area, in the same area on my left side.
Got it. And if you could rate that pain on a scale of 1 to 10, 1 being minor pain, 10 being severe, what would you say?
I would say probably right now about a 7 or 8.
About a 7, so it is pretty severe.
Yes.
Okay. And does it exacerbate with physical interactions? Like, have you played since the injury?
I went out trying to try it a little bit, but
okay.
they recommended me not to.
Got it. Okay. So even sitting kind of at a baseline, you're still at about a 7.
Yeah.
Okay. So just to address a couple things about the head, possible head injury. So you hit your head. Was that witnessed? I assume coaches, referees. Yeah. Okay. Is there any point where you think you may have blacked out or lost consciousness?
No, I didn't die in this fashion.
Did you need assistance getting up, or were you able to get up on your own?
I needed assistance getting up, but okay. I walked off on my own.
Did you have a cranial nerve exam or any kind of head injury inspection done, post-concussion, anything like that?
Not yet.
Okay. Looks like it's been about 2.5 hours, so we should probably go ahead and get that done. I don't think just talking to you now you're able to speak to me coherently. It doesn't look like there's anything that would be going on there, but it's always a good idea to have it checked out, and of course it is mandatory given that you play professionally. So we will go ahead and take care of that. And then I'll do a little more of the isolated injury inspection kind of once we get through all of that stuff, okay?
No problem.
All right, Mr. Johnson, so let me just go ahead and put this away. Oh, I'm sorry, I did just need to ask what your team number is.
Number 11.
Number 11, perfect. Just for documentation purposes. Okay. So we will go ahead and get started. I am going to put on a pair of gloves. Are you feeling okay right now? Any dizziness, nausea?
No dizziness.
Upset stomach, anything like that? Have you had a headache since it happened?
No.
No, you're feeling generally well except for the pain in the shoulder area.
Yeah.
Okay. Okay, so let's go ahead and get started. I am going to take your vital signs. for 1 second. Okay. Do you have any pain in your lower bicep area?
Not there, no.
No? Okay, so I'm gonna go ahead and take it on this side.
Okay.
If it does become uncomfortable, just let me know, okay?
Gotcha.
Okay. So I'll just have you stretch this arm out for me, palm up.
Gotcha.
Perfect. Just gonna hold this down in your artery here, and you will feel a little bit of a pumping up here, okay?
Gotcha.
Okay. 118/68. So your blood pressure is perfect. So seemingly no issues there.
Some good news.
Absolutely. So I will go ahead and take this off. So let's go ahead and move on. I'm going to check your pulse as well as your temperature. So I will get this on your finger.
Okay.
Oh, there you go. And then we can let that sit for a second and just relax while I check your temperature. Okay, 99.0, so it is just very slightly elevated. Or actually a little warmer on this side, which is something to know. I'm definitely getting a higher reading on this side, so that may be just signs of inflammation from the injury, so that is something that we'll look into a little closer. And it looks like your pulse is also within normal limits, so temperature just a little high for my liking.
Okay.
Are you feeling any swelling in that area?
More so maybe like around the shoulder area.
Okay. Okay. I'm just gonna document those results quickly. Blood pressure was very good. Pulse and respirations are all within normal limits. Temperature was the only thing that was just slightly elevated, specifically on that left side. All right, Mr. Johnson, so we are going to move on to a little bit of a cranial nerve exam. Essentially, we're just ruling out any possible brain injury that may have occurred when you fell, okay? So I have a couple things that we're going to go over, and the first thing I want to do is have you look at a couple stroke cards. Obviously, you didn't have a stroke. We use these in any cerebral vascular interpretations just to look for any signs of injury. So this may seem a little elementary, but again, we're just trying to rule out any signs of a possible brain injury here, okay? So I'm going to point to a couple objects, and I want you to just attempt to tell me what they are, okay? So can you tell me what this is?
Chair.
Perfect. And this here?
Canopy.
And this here?
Cactus.
Can you tell me which one of these objects you would use to open a door?
The key in the middle.
Perfect. Okay. And as far as this side, is there anything you notice that's unusual about the picture?
The running water, overflowing water.
Perfect. And who would you say of the three individuals here is in the most imminent danger?
I would say the kid.
Perfect. And can you tell me why?
Because the chair is already falling over.
Good. Okay. So moving on. I'm going to have you read a couple sentences for me. So can you read this first line?
You know how.
Good. And here?
I got home from work.
Perfect. And lastly?
Near the table in the dining room.
Good. Very good. Okay, so I'm going to have you read these words out one letter at a time.
MAMATIP-TOP.
Very good. And can you read this to me as a word? What does this say?
Tip top.
Good. And here?
50-50.
Good.
Huckleberry. Baseball player.
Perfect. Okay. So seemingly no issues with your cerebral vascular assessment. So we can go ahead and set this aside for now and move on to the next thing. And continuing on by testing some of your other cranial nerves, I am going to reach inside here. I'm going to do a brief test for visual acuity as well as testing for color deficiency, essentially just testing to see if you're colorblind, okay?
Okay. Do I take my glasses off?
You can actually leave them on for the initial portion of this test. So I want you to just look at this kind of arm length here. Can you read that very first letter?
E.
Perfect. And can you tell me what the smallest line on this card is that you can read?
I would say the hardest one. Oh, I could read the LTFPH.
Perfect. Okay. Can you tell me what color this is?
Red.
And this here?
Green.
Good. And I will have you use this to occlude one side. So just hold this up against your face. You can decide which side you'd like to use.
Okay.
Perfect. What is the smallest line you can read here?
LTFP.
Perfect.
And 4.
Okay. Can you switch sides for me? And the smallest line you can read?
LTFPH.
Good. Okay, so the other side you did miss the last letter, but that's okay. So I'm going to have you do that one more time. Remove your glasses for me. And what is the smallest line that you can read?
CFDHJ.
Okay, so still 20/25 without your glasses, which is pretty good. So that's not bad. You can go ahead and put your glasses back on. So now we are going to do a test for color deficiency. So these are called Ishihara test plates. And I'm just going to have you look at them one at a time. This first one is just a practice test. So can you see a number here?
Yes.
Can you tell me what that number is?
12.
Perfect. Can you see anything here?
8.
And here?
5.
Good.
29. 74.
Perfect.
7. 45.
Good. And a little bit harder.
2.
Do you see anything here?
No.
Okay.
16. I can't make it out.
Okay. Do you see any shapes or numbers? Do you see anything?
Almost like a snake.
Can you follow it with one of your fingers for me from beginning to end? Perfect. Okay. And here?
35. 96.
Very good. And lastly, do you see anything here?
Like a snake figure again.
Perfect. Can you follow that for me again? Perfect. So seemingly no issues with color deficiency. I do just want to test a couple more things as far as your eyes go. So what I'm going to do is just a very brief test for macular degeneration. So if I can have you hold this, it's going to have both sides occluded.
Okay.
So go ahead and hold it up. You should be able to see just a little bit here. Can you see my hand?
Yes.
Okay. I just want you to tell me how many fingers I'm holding up, okay?
Okay. 2, 1, 5, 1, 3.
Good. Go ahead and switch eyes for me.
I could just switch it.
That's okay.
Yeah, cool. 1, 2, 4, 5, 2, 3. 1, 5.
Perfect. Okay. So no issues with that. You are doing very well. So we are going to move on to the very last part of your eye exam. Let me just put this away. So I have a couple different colored test tubes here, and I'm going to do a test for your peripheral vision. Okay. So what I would like to do is firstly have you tell me what colors these are.
Green and red.
Perfect. So I'm going to come kind of behind you, and I'll bring either of these into the sides of your peripheral vision. Okay. I want you to attempt to keep your gaze midline at the point on the wall. Okay. Don't move your head. Okay. So for example, keep your eyes where they are. If I bring it in, I want you to say now when you see it.
Okay.
Okay? Are you ready?
Yes. Now. 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 Now.
Good.
Now.
Good.
Now. Now. Now.
Good.
Now. 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 Now.
Good. Do you see that on both sides?
Yes.
Good. Okay, perfect. So seemingly no issues with your peripheral vision. So we can go ahead and move on to a visualization of your pupils as well as testing for normal constriction and dilation. So this part might be slightly uncomfortable. I am going to be shining a pretty bright light into your eyes, okay? So for now, just look straight ahead for me. Just looking for any abnormalities with your pupils. Okay, so now I'm going to perform what's called a swinging light test. Okay. So I'm just going to hold your head steady here, and I'm going to swing my flashlight back and forth like a pendulum. Just relax, okay?
Okay.
Perfect, okay. So no abnormalities there. The next thing I'm going to do is have you follow the light. Okay. So you're quite literally just going to follow the light with your eyes only. Try not to move your head, okay?
Okay.
Very good. So the next thing I'm going to do is use my finger to hold open your eye, okay, and I'll have you move your eyes in whatever direction I give you, okay? Okay. So I want you to look all the way down. Good. And all the way up. And all the way towards me. And all the way to the right. Good. I'm going to do that again on this side. So look all the way down. And all the way up. Good. And all the way towards me. And then all the way to the right. Slightly dilated vessels on that side, but nothing overtly concerning. Okay. Very good. So let's go ahead and move on to the next portion of the examination. And I think at this point what I would like to do is move on to testing your sense of smell. Okay. So I have 3 small vials here, okay, and I'm going to have you close your eyes. I'll hold something up in front of your nose, and I'd like you to try to tell me what the smell is. Okay. They're all different from each other, but they are very similar. Gotcha. To give you a hint, they're pretty common smells, and they're slightly earthy. Okay. So you ready?
Yep. Rosemary?
Okay, very close. So let's try the second one.
Smelled that before. Gosh, is it? Nah, it's not lavender. It's not lavender.
It's not lavender, no.
Is it like is it the tea tree or something like that?
Very close. So
Okay.
let's try the third one and we can circle back.
Okay.
This one is the most obvious.
Oh, that's the one that gotta be lavender, right? Or no?
So this is orange.
Orange. Oh
Orange.
my God.
Okay.
Terrible.
So let's circle back to the
Alright.
second one. And the second one, the hint that I'll give you is that it's very close to the third one. Okay?
It's very close.
So
to
the
that
third one
Okay.
is orange. What
Right.
would you say this is?
That tangerine.
Very close. It's lemon. Okay.
Terrible smell.
That's okay. And then we're going to try the first one more time.
Alright.
And you did say what it was at one point for a different scent.
For a different
So
one?
let's see if you can guess what
So
that
is
is.
the tea tree?
That
one
is the
I
tea
said?
tree,
Okay.
yes.
Alright.
Very good. Okay. So we got 2 out of 3, which is not bad. I will chalk that up to you just not being very into essential oils. That's okay. That's okay. So the last thing I'm going to do is a very brief taste test. And same thing, I'll have you close your eyes. You're going to feel a tiny drop of liquid on your tongue. And I'd like you to just tell me what it tastes like. It might not be a specific taste. We're looking for savory or sweet or tart or sour. Okay? So stick your tongue out for me. And I'll have you tilt your head back just slightly. Perfect.
My teeth buds must be terrible. I feel like it
It's
tastes
okay.
like nothing.
Okay, so that is salt water.
Oh, salt. Okay.
Okay.
Yeah, I need to
So
taste
you
it.
said
It's
bitter,
terrible.
which is very similar.
It's terrible.
Does not taste good either way.
Nah, it's just like it just doesn't.
That's okay.
taste like it.
Okay, so the next thing I'm gonna do is just very briefly test your gag reflex. This might be slightly uncomfortable, but it shouldn't hurt or cause you any pain.
Okay.
So I'll have you stick your tongue out for me. Say ah. Good. Okay. And then if you can just stick your tongue out again and move it to one side of your mouth and the other side. Good. Okay. Just making sure there's no drift in your muscle there. So you did very well. All right. Are you feeling okay so far?
Yeah, I'm okay.
Yeah.
A little bit of pain still, but okay.
Okay. So we are going to do a bit of a hearing test. So moving on to a different part of your cranial nerve exam here. And in order to do that, I'm going to use a tool called an otoscope.
Okay.
Just while I have this out, since we already tested your eyes, I'm just going to use my ophthalmoscope to have a very brief look inside your eyes.
Okay.
Just looking for any injury that might have occurred upon impact here. So I'll just have you look straight ahead for me. I'm going to place my finger, just focus on my finger. And open your eyes wide, wide, wide. Perfect. Okay, good. And then if you can turn your head towards me just slightly. Same thing, focus here. Good. Okay, so I'm not seeing any sense of injury there. So I will go ahead and replace this with my otoscope tip. This might be slightly uncomfortable. I am going to insert this inside your ear. Any pain or pressure inside your ears?
No.
Okay. So I'm going to move your hair just slightly here.
Okay.
And it's going to be very cold, okay?
Gotcha.
So I'm going to pull your ear back. Okay. So I am able to visualize the tympanic membrane. It is normal in color and opaqueness. You do have a little bit of hardened dark wax here. Have you noticed any difficulties with your hearing?
Yeah, Tom's.
Okay, so I am seeing a little bit of wax buildup. Do you wear headphones a lot, like in-ear headphones?
Yep.
Okay.
When I work out.
Okay, so I'll have you turn your head for me so that I can visualize the other side. I apologize if that's slightly overextending. Same thing on this side. Definite buildup of some dark hardened wax. So we might need to discuss an outpatient appointment for you to get some of that removed because it is occluding about 1/3 of your ear canal.
Gotcha.
Okay. So unrelated to the injury, but you might need to see what's called an otolaryngologist, so that's an ear doctor, an ENT. So I'm going to do a hearing exam.
Okay.
And actually, because you have that built-up earwax, I'm going to do it slightly modified. Okay. So these are disposable ear covers, so I'm going to place these on your ears. And this is going to simulate an earbud.
Okay.
I want to test to see if your hearing is impaired long term here. So just have that kind of sit. I'm just gonna move your hair vertically just slightly. Okay. So I will have you close your eyes, and at first I'm gonna make a sound with my gloves.
Okay. And
I just want you to verbalize whether you hear it on the left or right side, okay?
Okay. Left. Right. 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 Left. 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 Both. A little bit of both. Left. Right.
Okay. So there's no issues with that. I have another device here that's gonna puff a little bit of air into your ear.
Okay.
So because you have these covers on, you won't be able to feel it. So it's going to be truly just based on what you can hear. Okay. So again, just say left or right.
Okay. Right. Left. 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 Behind me. Right. Left. 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 Up top.
Good.
Up top. Behind me.
Good.
Behind me. Left. Behind me. Behind me. Right.
Okay. So hang tight for 1 second. I have another tool.
Gotcha.
And this one is going to be testing the same thing. You did have a couple abnormalities there.
Okay.
So this is even smaller.
Okay.
And the sound is even more distinct. Okay.
Gotcha.
So directional hearing, it could be behind you, on top, below, or in front, as well as on either side. Okay.
Okay. Left. 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 Behind me. Up top.
Very good.
Right. Right. Behind me. Behind me. Behind the shoe. In front of me.
Very good.
Behind me. Left. Left. Right. Left. 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 Behind me.
Okay, so you're definitely having some abnormalities with your directional hearing. Almost all of the ones that you said were behind you were actually directly in front of your face. So the earwax that I'm seeing, the buildup is lower down in the canal,
Okay.
which is where the sound waves would penetrate from things in front of you. So I'm guessing that this buildup is probably due to your earbud usage. The way they sit in your ears, they kind of push the earwax down and impact it below in this area, which is why this is harder for you to hear. Versus when it's back here, the sound waves ping off the top of your ear canal, which are clear because they're not yet occluded by the earwax or the cerumen that's built up in your ear.
Okay.
So I'm definitely going to recommend that you see an ENT, okay? Just to get some of that cleared out for you.
For sure.
Okay. Do you have any questions about that?
No, not right now.
Okay. All right, Mr. Mr. Johnson, let's go ahead and move on to a sensation test. So I'm going to put these tools away, and the sensation test is going to rule out any damage that might have happened to your cranial nerves in the accident, okay?
Gotcha.
I'll remove these so you're not sitting here with these little
Gotcha.
hair nuts on your ear. There you go. Okay, so let me just put these away. So for the sensation test, let's start off with the basics since there's no obvious injury at this time. So I have a little tray here with several different things on it. And in addition to that, I am going to add this. Okay. So let's start with the most basic and simple. So this is a dull object. It's a little scratchy. It's just a regular sponge. Okay. So I'm going to swipe this or tap it on different areas of your face as well as your neck. Okay. And your arm here. Okay. At some point, if we see any abnormalities, we're probably going to have to remove this portion of your shirt just so I can access the area. But for now, let's attempt to do this with your shirt on. Okay. So I'll have you close your eyes for me, and I want you to just say yes when you feel it, okay?
Okay. Yes. 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 Yes.
And if I just go slightly in.
Yes. Yes.
Okay. And does this side feel any different than this side?
No.
Okay. And this side of your neck doesn't feel any different than this side?
No.
Perfect. Okay. So now let's do that again. And this time I have an object that is very, very soft on one side and a little sharp on the other side. Are you able to differentiate between those two sensations?
Yes.
Okay. So I'm going to touch you with either side, and I'd like you to verbalize soft or sharp.
Okay.
Okay?
Soft. Sharp. Sharp. Soft. 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 Sharp. Sharp. Soft. Sharp. Soft.
Good.
Sharp. Sharp. Soft. 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 Oh, sharp. 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 Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft.
Good. Okay. So no issues differentiating between the two. So what I would like to do now is test your ability to sense more than one stimuli at a time. Okay. So if you can feel two here.
Yep.
Okay. Versus this obviously is just one. So I'm going to do that in various points. So for example, this is two versus this is one.
Gotcha.
I want you to just say one or two depending on how many you feel, okay?
Okay. Two. Two. One. Two. One. Two. One. Two. One. One. Two. 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 One. Two. One. Two. Two. One. One. Two.
Very good. Okay, so no discrepancies with that. So we are going to make this a little more difficult. So I have a couple that, as you can see, are different. So I'm going to swipe these in kind of varying manners. So you might feel this, this. This one is very difficult to feel. So
a little small one.
Very small, very slight, okay? So whatever you feel, I want you to just say yes.
Okay. Yes. 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 Yes.
good?
Yes. Yes. Yes.
Good. And there's no difference
Yes.
in sensation here versus here.
Nope.
Okay. All right, Mason, you're doing very well. So we're gonna move on to a sharp sensation test.
All right.
It does look a little scary. I
Very
promise it's
scary.
not gonna hurt you. So this is called a Wartenberg wheel. It is very sharp. So I'll have you hold your hand out for me just so I can give you an example. So it's gonna feel like this.
Okay.
It's very distinct, but it won't penetrate your skin or make you bleed or anything like that. It's
Okay.
just to test your ability to sense very sharp sensations, okay?
Gotcha.
So this one is a little different in that I might slide it across certain areas or just barely touch it to your skin.
Okay.
Either way to start, I just want you to say yes if you feel it, okay?
Gotcha. Yes. 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 Yes.
Can you feel this over your shirt?
Yeah.
Okay.
Yes. 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 Yes.
Perfect. So now I'm going to test a little bit of sensation variance here. So what I'm going to do is just hold your hair,
Okay.
and I want you to tell me as I move this along if the sensation becomes any duller or sharper in any areas or if it feels consistent throughout, okay?
Okay.
So tell me if this feels the same as I go all the way down.
I feel like it's getting a little bit harder. But
Harder
still,
here.
yeah.
Okay.
Yeah. A little bit harder as you go down that way.
Okay. Harder here.
down
So I'm going to do the same thing, and I want you to tell me at what point you feel that it starts to get sharper or harder, okay?
Okay.
So you can just say now when it feels different.
there. Now.
Okay. And if I move laterally from back to front, same thing?
Yep. Now.
Okay. So if I move coming from this side over to the left,
Yeah. Around there.
Sharper
now.
still here, too?
Sharper there.
okay. And just to compare this side, does that feel any different as I come across or come down?
It's not as sharp when you're coming down on this side, the
It's
right
not.
side than the left.
Right, so this area specifically,
Mm-hmm.
not as sharp as this
Yeah.
area.
Yeah.
So definitely some oversensitivity in this little quadrant here,
Okay.
which is where we also saw that change in temperature too. So I am
Yeah.
going to guess that there is a little bit of inflammation here.
Yeah.
So what I'm going to do to actually test for that inflammation is I have an acupressure tool here.
Okay.
So this is going to allow me to provide just a little bit of pressure into a specific area.
Okay.
And I want you to tell me when it starts to feel more severe. So this is going to be a little bit uncomfortable
Okay.
because I'm basically putting pressure on a swollen edematous area.
Gotcha.
So it shouldn't hurt at all on this side. Slightly
Yeah.
uncomfortable maybe.
Yeah, a little bit.
But this side
Yeah, that
probably
side
doesn't
is-
feel very good.
Yeah.
Okay. So what I want you to do is, it's graded on a spring. So I'm going to push it down in on that side.
Okay.
I want you to tell me at what point it becomes painful, and then we'll
Okay.
compare it to this side, okay?
Gotcha. Right there.
Okay, so almost all the way down. And then we'll compare that to this side. It is
Okay.
going to be a little bit uncomfortable, okay?
Right there.
Okay, so that one, the spring didn't even load.
Gotcha.
So this side is definitely significantly
Yeah.
more painful. So what I'm going to do then is move this down and do that at different points up until we get to the point where it hurts the most, just to
Okay.
see what the difference is, okay? Looking for degree of injury here.
Gotcha.
So I'm going to hold your hair back. So here,
Right there.
okay, so equal to the other side.
Yeah.
And here,
Right there.
so slightly less.
There's a definite no-go.
Okay.
Yeah, nah.
Okay. So of this area, can you tell me when it's the most painful?
Mainly when any
anytime you start pushing down.
So anywhere here it hurts. Okay. So what if we come down towards the clavicle?
That one isn't too bad, but like
still doesn't feel great
still like,
in comparison to this side.
Which is like, nah. I don't
That
feel
side
really
doesn't bother you
yeah,
at all.
not at all.
Okay. And if we come behind the shoulder,
a little bit there,
little
probably
sore.
a little before you get all the way to the end.
so here,
Yeah. Yeah, right there. Right there. Mm-hmm. Yeah, right there is it.
here.
Yeah.
Okay. So I think we're gonna have to do a little bit of pressure point therapy in this area. I might actually also do a couple cups here just to get rid of some of that excess edema because you are
very tense.
pretty swollen and tense in this area, which is causing a little bit of concern. So at this point in the examination, if you're comfortable, I would like you to remove your shirt.
Yeah.
You can either take it all the way off or just remove it so that I can visualize this area. It's up to you. So I'll give you just a second to do that, okay?
Yep. Gotcha.
All right, Mason, so we're gonna go ahead and have a closer look at this area. So now that it is fully accessible to me, I'm gonna just have a look with my pen light. So just any increase in swelling to the area. Are you tender at all at this lower part of your arm? This all feels okay.
Not the lower, mainly the upper.
Okay, so as I move up here, can you tell me where it starts to hurt?
Like right there.
Here.
Mm-hmm.
And all of this is pretty tender, but the most painful area seems to be kind of
up
here.
there. Yeah.
Okay. So there's nothing that is outwardly leading me to believe that there's anything dislocated. Your clavicle is still in place. There's nothing that appears to be out of place. So that's the good news, right? So there's no severe injury that would lead me to believe you need to be put in a cast or a splint or anything like that. So that is the good news. Now the bad news is that I do believe you have torn one of the muscles in your clavicle. So possibly upon extension, we're gonna have an increase of pain here. So I'm gonna do a couple tests of your mobility. And we will see if there are any more severe causes for concern here, okay? So, grab my calipers. So that I can test for any variance here. And before I do that, I'm going to use my stethoscope to listen for any occlusions and blood flow in the area. So just in case anything more severe were to have been damaged, I'm going to compare this to the other side and it will just help me listen for any obvious abnormality. So I'm going to start with the side that is not injured and just place this here. It's very cold.
Okay.
Just listening for any occlusions and blood flow. Okay, so all of that sounds normal, which is good news. Okay, so no major signs of injury here. So we are going to go ahead and move on, and I am going to check to see how significant the swelling is. So I'm just going to use my calipers to do a couple measurements here. So I am definitely seeing an increase of pressure. So it looks like there's just a little bit of swelling here. So well as here. Here as well, I'm seeing a little bit. Okay. Okay. So I would say moderate swelling. Okay.
Yep.
So what we're gonna do now is test some movements in your arm.
Okay.
So this is gonna be a little bit uncomfortable, but I wanna see what your mobility is at this time, okay? So I'm gonna have you give me your arm here and we're gonna bring it parallel to your side. I'm gonna move it up. Is that painful?
Like right there.
Here?
Yeah, a little bit.
So on a scale of 1 to 10, how painful is that?
Probably still like a 7.
A 7.
Yeah.
Tell me when it's at a 10, I apologize.
Right there.
Okay, so maximum extension there.
Yeah.
And if we bring it down to your side,
Not too bad, but like right here is where it starts to hurt.
still painful.
Yeah.
And if we bring it all the way in,
Yeah.
10 out of 10.
Yeah.
Okay. So what I'm going to do now is bring it up
Right there.
here.
That's where it starts to.
Okay.
Yep.
Right there. Okay. And then we're going to bring it back.
Right there. Right there, yep.
Okay. So next thing I'm going to have you do is straighten your elbow for me. Is that painful at all?
Not too much.
We're going to pronate here. So turn your, there you go.
Yeah, right.
So bend your arm.
Yeah, like right here. Is
Painful
where I feel
there.
a little bit of pain, yeah.
A
And
little
as you
to
go up and
more
around.
painful.
Yeah.
Is there any point where it's too painful?
Right here.
Here. Okay. So definitely lack or loss of mobility here. All seemingly related to this area. Okay, so I'm just going to tuck your shirt out of the way.
Okay.
And what I'm going to do now is a little bit of acupressure therapy. So I'm actually going to use just a very small amount of that tea tree that we used for our smell test.
Okay.
And tea tree just acts as a little bit of a carrier to allow me to deeper penetrate those tighter areas. So this tool is tiny but mighty, so it is going to be a little bit painful, but it is necessary to help break up some of that tension.
Gotcha.
If at any point it's just so painful that you can't stand it, please let me know, okay?
Alright.
So essentially I'm just putting pressures on the areas that are just kind of micro tears in between there, okay?
Yeah, right there.
So eventually it should start to feel better, but it is obviously uncomfortable. So try not to tense up your arm here, I feel
Gotcha.
you.
I'm trying.
I know
I
it's
was thinking
hard.
about
I
it.
know it's hard. Very good. So we already got a little bit of release there. Good. Good. Now coming behind the muscle. Doing okay? Very good. So I'm already seeing some very small improvements. Good. So now what I'm going to do is use the other side of my tool, so it's just a wider area. And this time I'm going to be applying circular pressure, okay?
Okay.
So it shouldn't hurt quite as much.
Yeah.
Make sure you relax that
Gotcha.
up. There you go. Good.
Gotcha.
Doing okay?
Yeah. So I go in there.
Good. Okay. So let's see. I think I'm gonna take out a couple specialty tools here. Start with this. So I am going to use this. This is a vibration tool, so it's going to make a vibrating sound.
Okay.
It's going to make a vibrating sensation. This should penetrate down into your muscle. Shouldn't hurt, but it does kind of tickle a little bit because you're going to feel it move. So just to warn you, some people find it uncomfortable. Very good, right in between that muscle there. Good.
Yep.
Great. Uncomfortable here.
A little bit, yeah.
Okay. That should feel better.
Yes.
Very good. Okay. So now what I'm going to do is some isolated cold therapy. So you're going to feel my gloves on either side of the muscle here.
Okay.
This is just going to help to kind of manually reduce that inflammation.
Okay.
This shouldn't hurt, but it is very cold.
Yeah.
Okay, you're doing great. So before I move on to a little bit of cupping therapy, we're going to retest some of that mobility. So let's see if we made any improvements here. So let's go.
Yeah, that's where it started coming in back in that.
Okay, so that's better than it was before because this was about the highest point you could tolerate prior to. So let's extend even further.
Thing right there.
Very
Yeah,
good.
that's where it
Okay.
started, yep.
So now we're going to go down and back.
Right there.
Okay. Come out towards me.
Right there.
Okay. And at this point, still not able to extend fully, but I am seeing some improvement. Any pain down here?
Not too much.
Not too bad.
Yeah.
Not as bad as this area.
Yeah, no.
Okay, good. I'll have you relax your arm. And I think the last couple of things I'm going to do today, just a little bit of cupping therapy. So I'll place this here if that's okay with you.
Absolutely.
And these are just cupping devices. So
Okay.
I'm going to place this on different areas of the skin. And you'll feel me pump
Okay.
up a little bit. It's going to feel a little tight, but it shouldn't cause you any pain, okay? So essentially this is forcing the inflammation to move.
Okay.
Okay.
first time doing this.
You can let me know if it hurts, but it shouldn't.
Yeah, no, that's all right.
Good. Clicking sound is normal.
Yeah. Always surprised you at first.
Doing great. I'm going to move a little higher up, and this one is right on that muscle, so it's going to feel a little tight.
Yeah.
So I'm going to try a smaller one.
Okay.
Okay, so essentially what we're doing is surrounding the area of injury. So
Okay.
we've got it completely surrounded here, and we are pulling that inflammation out and away to disperse it into other areas of your body so that your
Okay.
lymphatic system can do its job and get rid of that excess swelling.
Got it.
So we're pulling all of that away. I'm gonna let these sit on for just a minute while I have you practice with some other therapies, okay?
Okay, no worries.
So what I'm gonna do is have you go home with some therapy putty. I'm sure you've seen this before.
Yes.
And this is essentially gonna help just build strength back in that muscle because I am gonna have you rest it
Okay.
for the next about 7 or 8 days, okay? So in that time, we obviously don't want you losing any of your muscle mass. So we're gonna do some very minor exercises to help keep that strength and mobility up.
Okay.
So I'm gonna have you use your therapy putty 3 times a day for about 15 minutes each cycle. So what you're
Okay.
gonna do is hold on to it.
Okay.
And I'm sure you know the usual,
Just
you're gonna
squeeze.
hold for 10,
Yep.
release, hold for 10, release. You'll do that for about 60 seconds.
Gotcha.
And then the other exercises I'm gonna have you do is try to pull it apart. So this one is gonna be a little more difficult because when you do this, I want you to keep your elbows parallel to your hips,
Okay.
and you're gonna hold here
Okay.
and pull away,
Gotcha.
okay?
Yeah.
So eventually you should be able to pull to where your extension is all the way out and you've released the capacity of the body, okay?
Gotcha.
So right now that's gonna be a little painful.
Gotcha.
So you'll practice doing that. In about 5 to 6 days, you should totally be able to just pull it apart with your normal strength, okay?
Alright.
So I'll have you practice one now. So it's a little hard while you're laying, but, and then remember hands. Good.
Hands up.
Mm-hmm.
That's yeah. That's
Right about there. Okay.
Yeah.
So in the next couple days, you should see some changes there.
Okay.
And you're gonna do that same thing, pull it apart, put it back together, pull it apart for about 60 seconds.
Okay.
And we're gonna do these in rotations for about 15 minutes a day. So it is a little redundant, 10 to 15 minutes. So you can do 5 in the morning, 10 at night, whatever you wanna do as long as you get your time in.
Okay.
And then the other thing you can do is just kinda squeeze
Just
and
squeeze.
release, squeeze and release, squeeze and
Okay.
release, okay?
Alright.
So I'm gonna send you with this. Your assistant physical therapist that's at the site should have these also if you
Yeah.
happen to need any when it gets
Yeah,
dirty or
yeah.
whatever the case is. You know,
Bloody
they have you guys use them pretty
hand
frequently.
injuries
Yeah.
and everything. She's giving them all.
So what I'm gonna do while we have the cups in
Okay.
is produce just a slight vibrating sound and touch it to the end of them.
Okay.
And that's just gonna help with the release.
Okay.
Okay. I'm gonna do a little bit of bone conduction, so I'm just gonna place this right on the bone. Just allow that to do its job. And the clavicle might be slightly uncomfortable.
Yeah. Mm.
And on the scapula. Good. Okay. And no change with cold sensation. You can feel the cold.
Yeah, I can feel the cold.
Doesn't feel warm anywhere.
No.
Okay. Very good. So we can go ahead and release these now.
Okay.
Good. So definitely see some slight bruising here. That'll go away in the next couple of days.
Gotcha. Let me go.
Okay, so these areas are going to be a little tender.
Okay.
And like I said, you are going to have some bruising, but it will go away.
Gotcha.
So let me just put this away. And then I have one last thing we'll do before I send you off, okay?
All right. Sounds good.
I'm just going to use my ice roller. This is very, very cold to
Okay.
help reduce some of that excess inflammation, okay? So
Gotcha.
just relax. It's not going to feel great.
Gotcha.
Okay, I'm going to finish up by pushing down and away from the heart.
All right.
So I'm not going to put you in a sling, but I do want you to just be mindful of overextension. So don't extend to the point of discomfort for the next few days.
Gotcha.
I don't want you to be sedentary. So as far as dribble practice and that kind of thing, you're fine.
Okay.
Hold off on the layups for the next couple days.
Gotcha.
Don't overdo it. And then definitely no contact play.
Okay.
So you can practice with the team if you'd like, but just keep in mind, I will give a note to the coach. I don't want you doing any kind of one-on-one heavy contact game just yet,
Gotcha.
okay?
Gotcha. No worries.
Right, Mr. Johnson, well, that's all I have for you today. So I am going to get with my assistant PT over at the arena and let her know that I want her to continue this cupping therapy for about the next 7 or 8 days.
Gotcha.
So when you're on site, just let them know. She'll know what to do. She'll get you hooked up. We'll have you cup for a couple minutes at a time. We'll do some on and off heat and ice therapy.
All right.
If you're having any residual pain, you can take some Tylenol. You shouldn't need anything more than that.
All right.
And then just make sure you're keeping up with your exercises and you should be good to go.
All
I
right.
will have her do the reassessment obviously before you return to full gameplay, and then at that point I don't foresee there being any ongoing issues, but if there is, she'll let me know. Okay?
Sounds good.
Do you have any questions?
No questions
You
from
feel
me.
okay?
Feeling all right. Feeling better than ain't nothing broken.
Okay. Good. So I will give you this and I'll let you get dressed, and I hope you have a good day.
Thank you, Doc.
Thank you for coming in.
All right.